Hi guys, my name is Isabel Vega.
And my name is Melissa Alvarez.
And this is our presentation on physical therapy. To introduce ourselves first, again, my name is Isabel Vega. I'm currently a third year at Cal Poly Pomona. My future career goal is to be a physical therapist, and today's lesson will entail how to restore ability to the legs, including the injuries like ankles and your knees and much more.
Hi guys, my name is Melissa Alvarez and I am a third year kinesiology major at Cal Poly Pomona. My future goal is to be a physical therapist for professional athletes, and today I will be teaching you guys on how to strengthen back your movements in your shoulders, arms, and hands.
So our student learning outcomes, for mine, they're going to be learning new techniques if or when an injury occurs, learning that patient is key when dealing with an injury, and how to prevent injuries once you're fully recovered.
And then my outcomes are going to be learning stretches and exercises and new techniques for the injuries, such as for the arms, hands, and shoulders. And then I'll be also talking about the importance of rehabilitation and also the psychological aspect of rehabilitation and recovery, so finding hope and relearning movements.
So to start off, learning new techniques. When an injury occurs, you want to make sure that it is not too damaged, meaning like you could still move it around. So if like you could still feel your toes, or like you can move your ankles, that means you still have a full range of motion with it. Then once you figure that out, we need to learn some techniques or exercise to strengthen that part. In this case, I'll be mentioning the legs. First, we'll be talking about the knees. So here's a video to demonstrate knees pain and release.
One is what we call pressure on, pressure off. So you're going to go ahead and you can grab, top and below like this, and you can do it yourself.
Yeah, it's usually people are more relaxed if they do it to themselves.
Right.
So you're just going to push down, pressure on, and just like Bob was saying, just say pressure on, pressure off. Pressure on, usually about 10 times in a row, and then come back later on.
The first day I would only do it one set because I still remember this. I did it to somebody that the first time, and it was really working, and we did like 4 sets. He was so sore the next day. I mean, and then it ended up working, but he almost didn't want to come back to therapy because we got him so sore.
Right. So start gradually.
Yeah, and again, like you said, the pressure on tells you how long you're supposed to push.
Yeah.
Pressure on, pressure off. So that gives you an indicator of how long.
And typically by the 10th one, it goes down farther and it feels better overall. If it gets worse and worse and worse, just stop.
Now this may seem a little counterintuitive, Brett.
All right. So now that we showed a little demonstration, I'm gonna do it to Melissa over here. Melissa here sitting down, and she's going to put her leg out a little bit, and she's gonna put both legs on there. If she did have a knee injury, one of them would be lifted than the other. That means that this one's not fully stretched out. So it mentioned in the video that they were doing pressure down and then bring it back up, pressure down and bring it back up. Now they said that you can also add a weight if you need to. So if you do this a lot more times, like throughout the days or throughout the weeks, it would finally go to a straight motion and her knees are now equal. So that's what would we do if you had a knee injury. So what we'll be doing is patience is key. When someone has an injury, people tend to get frustrated and upset because they feel like nothing is working, which means that they're like giving up and they think that doing all these exercises is not doing anything for them. So the most important thing here is to know that it is going to be a long journey of recovering, and only time will help you out. So that means if you exercise 3 times a day or 4 times a week, just continuously doing it, it would help improve it, and also you can get back on your feet as quickly as possible. So the next technique we'll be showing you is how to strengthen and stretch out the ankle. So here's another video on that.
get a stretch with it, so it comes into the dorsiflexion. What are you looking at there, Bob?
I was just thinking of our thumbnail we're going to have. This
Oh, okay.
So
That's a good idea. Got to keep that in mind. And you're going to do repetitions. I know my wife has been watching some of her videos. She says, Brad, you got to let them know how many repetitions.
Okay.
So sometimes we forget that. So you're going to do 10 to 15 of these.
Sorry, Julie.
Yes. Well, you know, we got to.
She's right.
Quality control.
As all wives are.
Say no more, Bob.
That's right.
Now, we also want to get eversion, so the ankle muscles going out. And this works well. You can just put one foot like this.
See what he did there? Okay, he's got it pulled, and then he takes the other foot, pushes down like that. And now look at that, a little tricky.
You're not going to do this on a stool. You're going to do it on the floor, but this way it's a better angle for the camera. And then you're just simply going to go out like this. Again, 10 to 15 reps, and then give it a rest. And if it's feeling good, you can do another.
All right. So now I'm going to demonstrate it on Melissa now. I'm going to have Melissa use a resistant brand. So she's going to hold it like this, and she's going to pull a little bit, and then she's going to flex her leg, and then come back, flex again, come back. And like you mentioned, you said to do this about 10 times, and this way it's strengthening the ankle, and it's easy. You could be sitting down, do this on a daily. Like I said, patience is key, so if you do this a lot while you're watching TV or not reading a book because you need your hands, but if you do this as much as you can, then your ankle will, get better. And last but not least, how to prevent more injuries after recovery. So once you're fully recovered, remember that never go too hard or do activities that might be too much on the injury, because you don't want to go through that process again of relearning everything. So try your best to limit yourself, maybe gradually get into like difficult stuff, but always start out light. Don't push yourself too much. Always remember to continue doing the same exercises or stretches even if you feel fully recovered. Sometimes you may think you're fully recovered, but it might not be. So here and there you can do the exercises and the stretches. You don't have to do it as much as you were when you were trying to regain it, but you can do it maybe 2 times a week, or 2 times a day. That way it still needs to be strengthened and stuff like that. The last technique we wanted to show you will be helping the whole leg in general. So here is another video on that.
And now you might think, why was he just doing straight leg raises? Because it's got nothing to do with the ankle.
Exactly.
But it does.
It does, because you want to promote circulation through the whole leg.
Right.
The arteries, coming from up in the body here, the main femoral nerve artery vein.
Right.
So you want to make sure that you're working everything. I put the one leg up like this, and you just start doing some straight leg raises like this.
And the fluid all has to move this way anyways. If you're plugged up here, it's not going to circulate through, so to speak. It doesn't really get plugged up, but we want that motion, that fluid moving throughout the whole leg. Plus, you got gravity. When you're up here, you got gravity working down, which is a big help.
Yeah, those are not that easy to do either. By the way, I was starting to feel it in the 15. Of course, I got a long limb here.
Yeah, he's 6.5 foot tall. You got a 6 foot leg.
Yeah. All right. Then we're gonna do hip abduction, Brad. I don't know if this is my best side, but I'm gonna go ahead and go out and start doing some abduction here. I'm keeping the toes straight forward.
I'll stand here so they only can see your leg.
I'm not going like this.
Yeah.
I'm not going down like this. I'm going toes straight forward.
So he's talking about, if you didn't see that, because the tendency is for this to happen.
Right.
So keep it this way, and that's going to work the stabilizing muscle. Make your walking more stable, too.
So I'd say just, again, you don't have to take a long time. A lot of these you can do in bed before you even get out of bed.
Sure.
Now I'm going to show it on Melissa. Now I'm going to have Melissa do the same exercise as he was doing. So she's going to put this leg down. All right. And then you're going to have your arms to your side. And then you're just going to bring your leg up all the way, the other leg. The leg that is flat. So the leg that is flat is going to come up. as much as she can. There you go. And back down. Back up. And back down. Back up. And back down. And what she's doing is basically helping her whole leg stretch out. And if she does this, again, as much as she can during the day, it will really help out the hip flexors and just the leg in general. And then one more that he did, so you're going to turn on your side. And then you're going to stretch this leg out fully. So just this one, all the way out. There you go, like that. And you're going to keep your toes this way. And then you're going to go up and down. There you go. Up and down. That's really just going to help, again, with the same hip flexors and, again, the leg in general. And if she does that for both legs, then it's going to help in the end if she had an injury in her hips or something like that. There you go.
Hi guys, I'm going to be talking to you guys about the importance of rehabilitation. So once an injury occurs, the patient wants to get back out there very quickly and be 100%. However, for all serious injuries, rehabilitation is key, restoring strength, flexibility, and endurance. So injury rehabilitation has two major key goals. First, it is to help patients regain their pre-injury levels of physical stamina and physical fitness. And the second is to strengthen the individuals to prevent future injuries. During the recovery process, a lot of emphasis is put on restoring muscle endurance and muscle power. Endurance is the muscle's ability to continually work without getting tired. So the part 2 of this is it is also important to not go over and beyond on exercises, and it can just overdo the body and muscles and create more pain in the injury itself. So this is when you have major pain in either your body parts or like in like the injury itself. That means that like your body is telling you that you need to slow down or just stop the exercise that you're doing. This also allows patients to regain their pre-injury strength, flexibility, and balance. Will also help them prevent re-injuring themselves in the future, like Isabel said before. So I'm going to be talking to you guys about the psychological aspect of rehabilitation. So a lot of patients or athletes get discouraged when an injury happens due to the fact that they are limited to what they can do or even not even play the sport in general. People get in a funk that physical therapy isn't working for them and won't be back to their 100%. It takes time and it should not be rushed. It is also important to always do exercises and stretches that your physical therapist provides you and does at home. So the first stretches and exercises that I will be talking to you guys about is wrist flexors and extensors. So this can help you with pain in your wrist. So if you work in the office or playing sports that revolve using your hands or wrist.
30 seconds, and then we're going to do a little 10-second break in between. So let's go ahead and get started with the stretches for the wrist flexors and extensors. So you're going to put your hands out in front of you, and we'll start with stretching the wrist extensors first. So just going downwards. So with this, if you just hold it this way, you get a lot of stretch. If this is too much stretch, put your fingers out and it's just a little bit less of a stretch. If you want even more of a stretch, you can push in on your hand and curl it in, and that will give you even more of a stretch. So after that little 10-second break, these are great if you're working at a desk, especially on a computer for long periods. If you're doing a lot of stuff with your hands, these are really great to do. So now we're going into the wrist flexors. So this time is kind of opposite. If you have your fist in a fist, it's not quite as much of a stretch, but if you open up your hands, you get even more of a stretch and you feel it under there. So again, if you want more stretch than that, you can just do a little pull, a gentle pull on each side, or you can put your hand up on a wall. So any kind of work with your hands a lot, these muscles get really tired, so it's great for these. If you're an artist.
Okay, so after seeing those stretches that you saw in the video, I'm going to be demonstrating these stretches on Isabel right here. So I'm going to make her do the extensors, so this stretch as you saw in the video, for 30 seconds. So you're basically going to put your arms out. So you're basically going to roll your wrists downwards and then up, down, and then up. So we're going to do that for 30 seconds. So start the timer so you can just keep doing that. So this basically just is helping your wrists in the extensors, and then after the stretch, we're going to be talking more about the flexors. I really feel it. It's a good exercise if you're in like the office, or if like you have like carpal tunnel, or like from like just like typing in general. Like this is a good exercise and stretch to do in like your everyday life, so you can prevent injury in your hands. Okay, and then now we're going to be doing the wrist movement of flexors. So you're going to basically go put your hands like this, and then for one arm you're just going to push it in, and then you're going to do that for 30 seconds. Hold it for 30 seconds, and then starting the timer. So this is also helps you, just like basically this hand is going to serve a point of like a resistance. So basically shown right there. This also is a good stretch for like just to prevent further injuries and just help you gain more endurance in your arms. In 5 more seconds. Alright, and stop. Perfect. Okay. So now that you guys saw me demonstrate the wrist flexors and extensors on Isabel, now I'm going to be talking to you guys more about the stretches and exercises of the shoulder and your rotator cuffs. So this is going to be focusing on adduction, flexion, and external rotation. So here's a video demonstrating you guys the exercises and stretches that I will be teaching Isabel.
You can use a cane or a broomstick or PVC pipe if you have some. Your arm is just going to go along for the ride. So the other arm's going to do all the movement. It's just going up and down. And then the other one's just sitting on top. Number 4. Now we're going to go into an abduction stretch with a stick. So again, I really like using the stick. It kind of helps get into that stretch. If you're still in a passive stage or an active assisted stage where you can't really move it on your own yet, like you're not supposed to because of precaution, or just because you can't because it still hurts a lot, using the stick really helps move that shoulder and that arm for you without you have to actively doing it. So let's check out the abduction. For shoulder abduction, passive range of motion with a stick, you can use a cane, a broomstick, or a PVC pipe if you have some. Your arm is just going to go along for the ride, and the other one's doing all the movement, so it's pushing the arm up. Just set your hand on top of the cane or the PVC pipe with your thumb pointed upwards, and then just push your arm up as comfortably as you can. Number 5 is going to be external rotation stretch with the stick. So same concept, you're using that stick to push through that motion to really get that stretch. And a lot of times, again, it's too painful to do, or maybe you're not supposed to actively use those muscles yet if you've had a surgery or something. So this is a great way to get that stretch in that passive or that active assisted range of motion. So let's take a look at that. For shoulder external rotation passive range of motion with a stick, you can use a cane, a broomstick, or PVC pipe if you have some. The arm is just going to go along for the ride, and the other one's going to do all the movement. Bend your elbow and put it by your side. Keep it there the whole time. Try not and let it come out. Then hold on to the pipe with your thumb up, and then push outwards and come back in. So remember, make sure that elbow is not coming away from your side.
Perfect. So after you saw those exercises, I'm going to be demonstrating these stretches on Isabel right now. Today I have Isabel with me, and I'm going to be demonstrating flexion with a stick. So as she said in the video, you can use a pipe, a stick, or a broomstick. So I have a broomstick with me right here. So we're going to be demonstrating flexion with a stick. So basically you're just going to hold out the stick, and then you're basically going to flatten this arm like this, and then just pushing it up and down. And then we're going to do that for 30 seconds and just keep doing that. So this is basically helping her rotator cuff, and the flexion of with like right here is going to be your rotator cuff, so it's going to be helping you with that pain. Okay, perfect. And now we're going to be talking about the abduction, which basically is going to be almost the same thing, but you're going to go in a motion of like slanted motion. So basically you're going to have your hand planted like this, and then you're just going to swing it to the side in an angle, and then just keep doing that in for 30 seconds. So this is going to be the abduction with a stick. So this also is going to be helping your rotator cuff as well. Okay, and now lastly we are going to be doing the external rotation with a stick. So this basically demonstrates, so it's going to be the same thing with your hand. So you're going to have this kind of straight with your thumb straight in the air, and basically going like this, but also keeping your elbow inside. So then you don't want your elbow to come out. So as you can see, like her elbow doesn't go out, it's still in. So she's going to be doing this for 30 seconds. And this again is going to be the external rotation with a stick. So then that is going to be 30 seconds. So now we are going to be moving on to the rest of the stretches. Okay, and the last stretch that we're going to be talking about is going to be the triceps. So this is going to be demonstrating on focusing on your arms and triceps. So this helps if you have tricep tendonitis. So just watch this video and then I will come back to you guys.
First stretch, take your hands, clasp them above your head, then turn them over, pushing your palms up towards the ceiling. So you want to hold this for about 30 seconds if you can. Now you might not be able to get this straight up in the air if you have that tendonitis in those triceps. So even if you're here or even a little bit lower getting that stretch, that's fine. But try and hold that stretch for about 30 seconds. Once you get that 30 seconds, give yourself like a 10-second relaxing of those muscles, and then do that a total of 3 times. So reversing those hands, pushing the palms up towards the ceiling, and really stretching. And you should feel it right through there. 3 times, 30 seconds. So the next one, you're going to use a towel or a belt, but something solid. So not like those resistive bands, but something that you can get a nice pull with. What you're going to do is the side you want to stretch, so if it's your right side, it's going to be up top. Take the belt and put it behind you. Grab the belt with the other hand and then pull downwards so that upper arm is being pulled down and back. And so again, that's going to be a stretch. So you want to hold that stretch for about 30 seconds and do 3 of those. So once you relax, give it about 10 seconds and then go again. So I'm going to do it from the front so you can see what my elbow does. It's kind of going up and backwards with that belt. So just getting that nice stretch. And again, you should feel it all through in here. Most of the time you'll feel it more through there. So 30 seconds, 3 times, just holding that stretch. If you don't have a belt or a towel handy, you can just do that stretch with your hand. So again, kind of take this hand up and over. Now, again, if it's really sore, you might have to start right here. You might not be able to get it up that far. But then just take your other hand, grab that elbow, and then just push up and back. So that's getting that nice tricep stretch. You're getting an inferior capsular stretch as well, so you might feel it in there if that whole shoulder joint is tight. But this is the main spot you'll probably feel it in. So the more you push backwards, the more of a stretch you'll get. So again, holding that for 30 seconds, take a little break in between, shake it out, and do that a total of 3 times. So now what we're going to do is some exercises. So this time you're going to do that going back behind you, but you are going to use a resistive band. Now with the resistive bands, depending on what brand they are, there are different colors for how strong they are. If you have the TheraBand brand, yellow's the lightest, red's the next one, and then it goes up from there. So you probably want to start off with a yellow. I just have a red because it's a good solid color. So again, you're going to take it and come back behind you, hold it with the other side, but this time you're going to pull upwards and then come back down nice and slowly. So really control that band. Don't let the band control you. So don't snap it back because that's going to irritate something even more. Just start off, nice slow pull up, nice slow pull down. Let me show you from the front again. So elbow up as high as you can comfortably get it, and then pull up, straightening out that elbow, and then nice and slow coming back down. And if you have that tendonitis in there, that might be slightly painful. So start off with something really light. Start off with just 10 repetitions. Take a little break. If it's feeling good, you can do some more, but don't overdo it because with that tendonitis, if you do too much, it's just going to flare it up even more. So if you're really, really flared up, don't do it with a band at all. Just take your hand and go up, straightening that elbow, and then come back down. First stretch, take your hands, clasp.
Perfect. So now I'm going to be demonstrating what she said to Isabel. So she saw, as you saw in the video, there's going to be 3 stretches I'm going to be demonstrating on Isabel. So the first one that she demonstrated is going to be, you're going to put your hands in the air and then kind of go like this and then pushing out. And then you're going to do this for a solid 30 seconds. Okay, so now the second stretch is going to be involving resistant bands. So as she said in the video, if you have resistant bands and just like different colors of the resistant band, so depending on what level you are in your rehab, so we're just going to do beginners, so that's going to be a yellow one. So basically you're going to be going in a downwards motion. So this is going to be helping your triceps right here. So as I said, we're going to be using the yellow one. So the yellow one's going to be the beginner, and the next level is going to be the green one. Then we have the blue, the red, and then the black right here. So that is the strongest resistance that you have. So this basically is like what you're going to use at the very end of your rehabilitation. So it's like you first want to start off lightly so you're not overdoing your muscles. So that is going to be the key. And then you're going to be using like the black one or throughout the different colors, like throughout your rehabilitation and your recovery process. And then the black one you're going to be using at the very end. Okay, so then now for the next stretch, we're going to be doing the same motion again. So then grab it. And then so instead of pulling downwards, we're going to be pulling upwards Yes, so upwards. Yeah. And we're going to be doing that for 30 seconds. So as you can see what Isabel is doing, she's grabbing the resistant band and then pushing it in an upward motion. And if you don't have resistant bands, then you can just use it on your just like your regular arm and just do the same motion as she's doing. And that will be
It really,
you can do 3 more. Perfect. Okay. So that includes all of the exercises for your triceps and is basically going to be helping if you have tricep tendonitis.
Thank you guys for listening. That ends our presentation. Again, my learning outcomes were basically working on new techniques, having patience because patience is key when recovering, and learning how to prevent more injuries when you're done recovering from an injury you had. And then Melissa?
So my outcomes were basically talking more about the importance of rehabilitation, the psychological part of rehabilitation, so never giving up, never losing hope, and then just the new techniques that you can be using for the stretches and exercises. So Isabel focused more on the lower extremity of the body, and then I focused more on the upper extremity, so meaning the arms, the hands, and the shoulders. And I basically just went more in depth with like the wrist flexors and extensors, the rotator cuffs, talking about the flexion, the abduction, and etc. And then about the arms, I talked about like your triceps, and just like if you have tricep tendonitis, like that's like other exercises that you can do. So that is our presentation of our teaching within physical therapy.
Woo, thank you for listening.
Thank
Bye.
you.
Peace out. All done. Jesus. And with time to spare. Just kidding. I don't even know.
I'm just kidding.
We're losing daylight. Okay, we're done.
Should we pause it?
No, I can like just continue it and then I can cut it.
Do I have to pull up my pants? Like I have not shaved. I'm shaving when I leave for Montana.
Next video. Okay. There we go. Okay. Okay. We just keep getting closer. Okay, and then I need the. You have the little thing. Huh? Oh shit! No, I didn't. God damn it! Testing 1, 2, 3. Okay. Take 1. Okay. On physical therapy.
Oh.
Please hold. Okay.
We're back.
Believe in you. I believe you'll find it. Oh my god, it's so windy! Okay, share.
I have Isabel here, and we're going to be demonstrating flexion with the stick. You can use honestly anything, like she said. You can use it with a pipe, a stick, or I'm going to be using a broomstick right here. So, oh my God,
Yeah.
we're recording. Take 3. Anyway.
Take 3.
So. Hi. Happy editing. Okay.